Last case, but certainly not least. This was this is a 68-year-old woman. This was a pretty impressive finding. So she came in 2020 and it was read as normal. 2021, there was this little area here that was detected because of the algorithm. It had a high case, there it is, 93 case score. So that's a pretty high case score. So when you see a 93 case score, you pause a little bit, you go a little bit slower. So why was it a 93? It was this area here was flagged as an 82, and this one was flagged as a 67. Now without it, you can say you'd call it back. Everyone's, retrospectoscope is 100% accurate, right? I don't know that I would have called that back. That is a tiny, fluffy cloud-like area in a sea of cloud-like areas. I don't think I would have called that back, right? So I would have read that as normal. That's a hard callback, but luckily, the software suggested we look at it again. There was a little bit of distortion. We called it back. You can see a little bit more on the diagnostic when we compress on that area. So we proceeded to ultrasound. There were a couple things seen at ultrasound. There was this hypoechoic mass at 12 o'clock, and then there's this irregular mass at 3 o'clock. That looks like cancer. We know we're going to look at that and say that's obvious cancer, right? So she proceeded for biopsy for both. This came back as a papilloma, and this came back as an invasive ductal. So this is a papilloma, and this is exactly that same spot that came back as an early IDC. In our institutions or in our system, we typically recommend excision for the papilloma as well. But you see this tiny abnormality within a sea of dense tissue, a sea of complexity, was caught early and quickly and accurately because of some guidance by the AI technology. And that's why Profound AI has been really useful for us, is because it guides us in a busy breast tissue, in a busy environment where we're reading tons and tons of images. It helps guide us to things that we may overlook. We all need it. And the interesting thing on this case is while we read it in 2021, I reran the case score for 2020 and it was still high. So back in 2020, if we had a 90 here, we may have caught it here. And I know we're all legends. We catch everything as early as we can, and we're heroes in our minds. We had a better chance at catching that cancer in 2020 if we had the software then. We didn't have the software then, but it shows you that there is an opportunity to catch more cancers. And that's what we get excited about at Solis. We want to catch every single cancer as early as possible. So we have learned to embrace this technology, learn its complexity, learn its nuances, review our cancers, see where it's right, and see the low case score cancers, and really get a deeper understanding of how the software works so that we don't miss a single cancer in any of our patients.